Have you ever stood in front of the mirror and thought to yourself, oh, if I could just tighten the skin a little bit here, it would be great? Well, the truth is that the face is complex and aging happens in multiple layers. It's not just your skin. And I'll go over those layers for you. Of course, the skin is what you see and what shows on the outside. And you do lose some collagen and some elasticity in your skin, and you can have sagging. But there are deeper layers. Underneath your skin, you have multiple fat pockets around the eyes, around the cheeks, in your temple, and even around the jawline. So as we age, some of those fat pockets shrink, some of them get larger. For example, in the chin, you accumulate more fat, but around the eyes, you may lose some of that fat. So those age as well. Under the fat, there are muscles, and there is a fascia that covers the muscle. That's called the SMAS. Everybody talks about SMAS facelifts. That's one of the structures that we lift during a facelift, and that layer can sag over time and relax. And below the muscles, there is bone. So you lose bone in some areas. For example, the socket of your eye gets wider and larger as we age. Your jawline can recede, especially if you lose teeth. So all of those changes happen during aging. And when we do a facelift, we want to address all those different layers. That's why a deep plane facelift is really a very popular technique. I've been doing facelift for 25 years. I have developed and changed my technique over the years, improved and incorporated small little nuances to address all of these concerns to create a very nice natural look. We take great care to make sure that the incisions are hidden in the shadows, around the ear and in the hairline, and that our patients look just like themselves. My patients will get compliments on their looks. They'll say, you look rested, you look like you've gone on vacation, your hair looks great, but no one can guess what they have had done. That is the secret of doing a very natural facelift. So why do some facelifts look pulled and fake? And I know that that is your primary concern, is because the surgeon really only lifted the skin and the superficial structures and not the deeper structures. When you pull the skin, it just makes you look like you're in a wind tunnel. We don't want to do that. That's why we really reposition all the deeper structures to where they belong. And we oftentimes combine other procedures like fat grafting, eyelid surgery. For example, if you come in and you have a little bit of hollowing in your temple and you have wrinkles in the corner of the eyes and your brow seems to be low, you may need a brow lift. There are different ways of doing that. We can incorporate a brow lift, an eyelid surgery, even a laser resurfacing to address the wrinkles on the face and blemishes like brown spots to create that natural look. We don't want you to look fake. We don't want you to look pulled. So the secret is to do this all in harmony to make you look natural. And that is the advantage of doing it in the deeper planes, so the skin can follow the structure of the deeper planes and look harmonious and natural. And that's our secret of making people look very natural.